Hi students, before starting, let me quickly explain how we are going to master Charak Samhita Siddhisthana in your AIPGT journey. I am Dr. Annapurna P, your Siddhisthana faculty. Together, we will decode all 12 chapters of Siddhisthana and exam-focused points. Your complete learning journey includes detailed decoding classes, AIPGT-based MCQ practice, Nectar High-Yield Revision Series, and next focused content, PDFs, audiobooks, live sessions, and personalized mentorship. Our AI-powered gamified ecosystem tracks your learning, performance, and progress to create a personalized preparation pathway for you. Today, you are watching a demo decoding class. To experience the complete journey with all features, explore the Vedas for Vaidyas app and unlock the complete AI integrated learning experience. For our NAVASANKALPA batch, we are opening only limited seats because our goal is not about numbers. Our goal is about giving dedicated personal mentorship throughout your AIPGT journey. Register now, complete your selection test, and if you qualify, you will become a part of this focused mentorship batch. But first, experience our teaching approach. Now let's dive into the chapter and begin our journey of Siddhisthana. Now let us decode this chapter from the Charaka Siddhisthana from the AIPGET examination perspective. So this specific chapter detailing the indications and contraindications for Panchakarma is an absolute high yield zone. When we look at the previous year question patterns, a clear trend emerges. The examiner's favorite area is the intreatable category. That is specifically the physiological and behavioral traits. You will frequently see multiple choice questions twisting the traits of a patient who hates authorities or acts whimsically. Do not confuse the general contraindications with the physiological states. For instance, in Vamana, the examiners will test your understanding of the why a pregnant woman or a patient with a heart disease is unfit. So they want to see if you know that giving Vamana to a cardiac patient causes cardiac displacement or that forcing Vamana in an Udavarta patient acts as a quick killer. You must understand this upward movement of Vata to realize why MSS is strictly forbidden here. And another highly repeated concept is that list of emergency exceptions for Vamana. You must know that even if it is contraindicated, Vamana is immediately you can administer in cases of actual poisoning, severe indigestion or intake of incompatible food. That exception list is prime scoring material. Your study strategy for this chapter must rely having on the classical analogies. These are repeatedly asked directly quote based questions. You do not need to memorize the entire Sanskrit verses, but you must link the specific analogy to specific therapy when you think of Vamana. Visualize an overflowing of the paddy field just as breaking the boundary saves the crop. Vamana eliminates kapha to save the body when reviving Virechana. Picture of burning house. Extinguishing the fire pacifies the pitta. For Niruha Basti, this concept is cutting the root of a tree to destroy Vata, while Anuvasana Basti is watering that exact same root to nourish the tissues. Finally, Nasa is compared to the extracting a stuck spike from the grass. If you map these 5 visual analogies in your mind, you will never lose marks on these conceptual questions. Moving to Virechana, pay close attention to the contraindications involving vascular and rectal trauma. An examiner will often ask why a patient with a prolapsed rectum cannot undergo Virechana. The clinical reality is the risk of death due to the excessive discharge. For Niruha Basti, the golden rule to remember is that anyone who has just undergone Vamana or Virechana is strictly unfit, and examiner will try to trick you placing a recently patient in a Basti option. Furthermore, always remember the specific rule that giving a niruha in a dry body burns like a alkali in a wood. For Anuvasana, the examiner is a trap is often the fasting patient. You must know the giving Anuvasana on empty stomach causes the medicine to travel upward dangerously. And stop reading this chapter like a continuous textbook and start viewing it as a grid of indications, absolute contraindications and emergent exceptions. Focus heavily on the reasoning behind the procedural failures. such as why treating a fatigued patient leads to a dry mouth, or why nasya after a head bath causes rhinitis. If you master these concepts clearly, this chapter becoming a guaranteed scoring area in the AIPGT. So before going to this chapter, previous chapter is Netra Basti Vapat. Here Acharya Charaka started explaining about the Vapats, that is complications. First he explained about the Netra Basti Vapats. Why? Because Basti is considered as a Ardha Chikitsa. He has given utmost importance to the Basti. So that is why previous chapter he explained about the Basti Vapats, that is arised because of the improper Netra, improper Basti Putaka, etc. So soon after this chapter, Acharya explained about Vamana Virechana Vapats. So here in this chapter, complications arised due to the Vamana Virechana has been explained in this chapter. Even why the Vapats are common while in the Vamana and Virechana procedures. So author, he has given the clarity why the Vapats are causing. See here, he has mentioned about the importance of the proper seasonal timing and the pre-procedural protocols. That is, so Vapats are common because of the improper Snehana and Svedana, and even sometimes Ajirna is there, we are giving the Vamana Aushadis before improper Snehana, Svedana happened. So that is also leading for the complications during the Vamana and Virechana procedures. And even we should also follow the proper Kala in terms of the Rutu. So that is why author, he has given the timing also, the Shodhana Kala and management. As Siddhisthana is going to deal with the management, Siddhi itself is considered as the success or the Safalata in the Chikitsa. So author explained all the Vapats and what is the proper Kala, Snehana, Svedana, Vamana Virechana should be given. If it is improper, then it is going to cause the complications. So that is all the contents of this chapter. Yes. So he started with the shloka with the explanation of Kala for Shodhana. See here, the procedures which should be generally be performed in this Sadharana Rutu. So in this, these are very important points. One should remember in MCQs, there is a chances of asking these questions like what are the Kala should be used for the Samshodhana procedures. See in this, they will give the options like A, B or all of the above chances will be more here. So what are the Kalas? First one is Pravrit, next one is Sharad, next one is Vasanta. Pravrit, Sharad, Vasanta, Shita, Grishma, Varsha. Why not we can not give the Shodhana here in this Rutus? Because Shita is considering as the excess coldness will be there in the atmosphere, and Grishma will be of excess the heat or the summer will be there, and even Varsha, there is a cloudy days. If you are giving the Shodhana in these Rutus, there is a chances of getting the more complications. Why? Because improper environmental condition. So if it is a Varsha, it is quite common, there is a cloudy days are more. So as already Charaka is explained, if you give Panchakarma, there should be no clouds. That is, if it is there, that is called as Durdina. You cannot give any of the type of Shodhanas, because that environmental condition, it is having certain effects on our body. So if you give medicines, that is going to becoming as a Ajirna. So that is what the concept. And even Shita and even excess Grishma. Grishma, because of the hot sun rays, if you give Vamana and Virechana, there will be the complications or Vata Vriddhi takes place. And one more thing is, see here Vata Prakopa leads for the Balahani. If you give Shodhana also, there will be the lack of strength. So the patient cannot withhold the medicinal properties. That is one thing. See here, the reason you are going to give Shodhana here is, these are considered as the Sadharana Rutu. What is Sadharana? There is no much rain, there is no much more of the heat or the sun rays. So it will be in the equilibrium state. So if it is the equilibrium state, your medicine will be digesting properly. You can go and give the snehapana and even svedana, all those procedures of shodhana, and hence you are going to get the proper benefits of the shodhana. Yeah. See here, so Pravrit is considered as Ashada, Shravana. The months are like Shuchi and Nabha. You can go and give the Basti here. And Sharad is in between Kartika and Margashisha Masa. So these are very important. Sometimes how they can ask Urja, Saha. So it is called as. So they can give you the options like Sharad, Varsha, Hemant, etc. things. So the right answer will be of Sharad. So they can ask it in terms of the months as well as Masa. For example, Pravrit belongs to which Masa? So there is the answer of Ashada and Shravana. And Vasanta also called as Falguna and Chaitra. So these are very important points. They can ask by these two of the Masa belongs to which Ritu, like this, or else Shuchi Nabha is also called as which Ritu. So answer will be of Pravrit. So these are very important here. So like P-A-S-N, you can prepare like this. So P stands for Pravrit, A is Ashada and Shravana, and this one is Nabha. So this is, you can Pravrit, you can go and give the Basti Karma, and Sharad like S-K-M-U-S, right. So Sharad, it is like Kartika and Margashisha, and it is also been considered as the months of Urja and Saha. As Sharad, you can commonly, we are knowing Sharad Ritu, there is a Pitta Vriddhi, we can give the Virechana Karma. And Vasanta is of V, P, C, T and M. See here Vasanta, it is also called as Falguna and Chaitra, Tapasa and Madhu. See here as Vasanta, it is generally you can go and give the Kapha. Kapha will be more here, that is why we can give the Vamana. In some of the hospitals we are going to give the Vasante Vamana. Vasante Vamana, it is one of the procedure we are going to adopt in this Vasanta Ritu, because naturally there is a Kapha Prakopa that you can go and release from the body. So it is easy to come out during that procedure. So that is why you can give the Vamana in Vasanta Ritu. Yeah, so Acharya has mentioned one of the simile here. This simile is very important. What is the importance of giving Snehana and Svedana before going to give the any of the Shodhana therapies? See here, you can see Toya Patra here. So this is what? Snigdha Toya Patra. This can be asked for MCQ. This simile they can ask. Snigdha Toya Patra. What happens here? So before going to Shodhana, any of the therapies, you can go with Snehana and Svedana. See what happens here, Kaphadi doshas are easily removable from the body that has undergone proper Snehana and Svedana. Just like the Toya or the water, it is removed from the Snigdha Patra. Vessel will be there. If you apply any of the Sneha, from that vessel you can easily remove the water. Why? Because the water is applying all the oil and hence you can easily remove it without any effort. Similarly, if you give Snehana and the Svedana, Snehana, it is going to increase the utkleshana of the malas of the body, and wherever malas are there in the body, the Sneha dravas go and attach to those malas or the impurities. Then later you must go with the Svedana. Svedastu dravati means after Svedana, after Snehana, if you give Svedana, Svedana Drava is having Ushna, Tikshna, Sukshma Gunas. So that is how this Ushna Guna, it goes and attached to all the micro parts of the body, Sukshma Shrotasas. It drags all the malas, or it makes the liquefaction, Dravata of the this malas and it brings up to the koshta. Then if you give Vamana and Virechana Aushadhi, then the medicine is easily comes out of the body, just like the Toya Patra. If you apply the Snigdha oil to the Patra, the water is easily comes out. So that is why Acharya highlighted this example, but this can be asked in your MCQ. Very important point it is. And so here this shloka goes, snigdhat patradhya toyam ayatnena pranudhyate. So this word is very, very important. Ayatnena. Ayatnena. Yatna is effort. Ayatna is there is no much effort is needed to remove the doshas from the body. Right? So snigdha deha aushadehe. So similarly you give snehana, the svedana, then later on you can go with the shodhana procedures. Yes. So but when you say Acharya Charaka is told, so we can give snehana and svedana. But there is a restriction to whom you cannot give the much of the snehana, because in some condition already sneha guna is increased in the body or the snigdhata is more in the body. In certain exceptions, you can directly give the shodhana. So conditions like Visarpa, Pidaka, Shofa, yes, Pidaka, Pandu, Kamala. So you can learn it from the Santarpani Adhyaya from Sutrasthana. Acharya, he has highlighted the Sandarpana Janya Vyadis. In that he mentioned all these points, Kushta, Pandu, this Jwara, Gauravata, and even these some of the Raktavaha Shroto diseases. Why? Because they are naturally arised because of the Ati Sneha or Ati Snigdhata of the body. Right. So in these conditions, you can give the Ruksha Virechana, because no need of giving the Snehana. Already Sneha Guna is more in the body. So you can select any of the Ruksha Dravas, you can give the Virechana. And if the body is not, see, one more thing is Sneha Virechana. Opposite to Ruksha Virechana is Sneha Virechana. If the body, the Snehana is not properly done, so you can give the Sneha Virechana. One of the example is Gandharva Hastadi Taila. So this Gandharva Hastadi Taila, it is the reference from Charaka Chikitsa Sthana 28th chapter, that is Vatavyadi Chikitsa. Here Acharya explains about the Mrudu Shodhana or the Snigdha Shodhana. Means this Gandharva Hasta, it is considered as Eranda Taila. So this Eranda Taila can be given along with the milk. So if you give this, the patient will be having the Sneha Virechana. Why? Because Eranda is having the this Snigdha and Ushna property. So hence it is going to produce the Sneha Virechana in the body. So that is one of the example you can understand for this Sneha Virechana. Yes. So one more example or the simile Acharya has produced here. So this word is very important. They can ask it like in which part of the Samhita the reference of Ardra Kashta is told. So answer is this chapter. See here what they have, you can see the image here. If you take the Kashta, Kashta is stick, but the stick is there along with some of the water particles. If you put the fire, what happens? Because the stick is wet one. If you put the fire leads for the, there is a sound in the stick. Okay. So that sound, see, moist wood will be there. So it is producing the kind of chat 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 sound. So what happens? See, how much time it is going to produce? Till the moisture gets evaporate from the stick. Right? So similarly, this Snehana, Svedana, it is going to cause the vriddhi of the dosha in the Shrotasas. It is going to liquefy and it is helps to make the dosha from Shaka to Koshta reason. So that is why he has given the simile to understand this concept. One more is, it is also very important one, Klishtam Vaso. You can see here, klishtam vaso yathotklesh malaha samshodhayate ambasaha. What is it? You can see the images here. One is dirty cloths, one is the proper one. What happens here? So this dirty cloth, it is there, you can clean it with the help of brush. Similarly, what happens here when you clean it with the brush, there is a increase of the mala and that is going to release. Similarly, if you give the snehana and svedana, so it helps to provoke the dosha, it helps to make the utkleshan of the dosha, thereby comes to the shaka. From shaka to koshta, gamana will be there, then you can go with the next shodhana procedures. See here. Yeah. So what are the factors which are helps for the proper samshodhana? You can see here, samyak snehana shodhana, as I already told the importance of this. And the next one is very important factor. It is ahara jirna. Why it is so important? Because when ajirna is there, if you give snehana shodhana, there will not be the proper effect, because ajirna there is a amas. It is like the pichila, guruta will be there. If you give sneha aushadhi, it won't get digest properly, it won't also absorb properly. That is why agni should be in the good condition. Then matravat aushadha. It is so important. The proper dosage of the drug is very important. If it is proper, then only it gives the samyak shodhana. If it is less, it is producing a yoga. If it is more, it is going to produce the ati yoga in the patient. And the last one is very important. Ekagramana. Concentrated mind will be there. If it is concentrated, then only the results will be good. Why? Because if the patient is very anxious, if it is bhaya bhita, if it is krodhi, there will be the increase of the vata, pitta, doshas. Krodha leads for pitta aggravation, and this shoka or even bhaya leads for the vata vriddhi. So there is no proper absorption of the medicines in the body. Yeah, see here. Yeah, I already told ajirna condition, you cannot give the medicine because it is going to cause the glani or even opposite action. If you give the medicines for vamana, it happens with videchana. If it is videchana, then it happens with vamana. Vice versa action will be happening here. Yes, then matravat aushadhi. So this shloka is also very important. It carries a weightage. They can pick 2 or 3 points. They can ask you the under which heading you studied. Like, so alpa matra mahavega. These are 2 lakshanas of dash. So that is comes with the matravat aushadhi. Alpa matram. Even if it is the good medicine or the proper one, even if you give the less dosage also, there will be the proper evacuation of the doshas take place. Mahavegam. Mahavegam means it produces the good vegas. Bahudoshaharam. Bahudoshaharam means all the cluster of the doshas will be removed with the help of these medicines. Sukham. It is very comfortable to intake as well as comfortable to expel all the doshas without any of the much difficulties. Then Laghu Paka. What is this Laghu Paka? So this Matravat Aushadhi, it is going to digest very easily. There is no much of the effort is needed for the digestion of these kind of the medicines. Yeah. So some of the continued lakshanas. Sukhaswadam Prinanam. It is, the taste is very good. That is going to increase the abhishandata of the body. What is abhishandata? That the pay itself is go and attach to the shrotasas. It is provoking the doshas there, or it is causing the shroto avarodha. So hence you cannot give in these conditions peyadikrama. What are those conditions? Alpa kapha pitta vishuddhata is there. Madhyapi, the patient is alcoholic. The patient is vata pitta prakriti. So if these are the conditions are there, you cannot give the peyadikrama. Instead you can go and give the tarpana. Very important one. Tarpana procedures you can Tarpana preparations you can use here. And this can be asked for MCQ because they'll ask it like contraindications of Peyadi Krama. So, Alpa Pitta Kapha, Vishuddhi, Madhyapi and Vata Pitta Prakriti. So, this all together they can give and try to find out the cause. So, cause is Abhishandata will be increased in the body. Hence, you cannot give the normal Peyadikrama. Instead, you can give the Tarpana. So, there are Chakrapani highlighted that two types of Tarpana. One is Acha Tarpana, one is Ghana Tarpana. Acha Tarpana is the variety of thin Tarpana and the Ghana one is thicker one. But Acha Tarpana you can use the Draksha, Parushaka, Karjura, etc. things, but should be prepared in the Shadanga Paniya Vidhi. And where the Ghana you can use the Laja, Madhu and Amalaki Swarasa, like Laja, Madhu and Amalaki Swarasa. So this is going to cause the Ghanata of the body. So these are the two options you can remember. So Ghana Tarpana and even Acha Tarpana. Yes. So here you can see Jirna Aushadha Lakshanas and Ajirna Aushadha Lakshanas. That's quite common. Jirna Aushadha Swasthita will be achieved and there's a Kshutrishna will be, the patient will be feel all these things and there's a proper Anulomana, Indriya Udgara Shuddhi and Manasvatha and even Lagutva is achieved. And opposite to these is Ajirna Lakshanas, like there's a Klama, Daha, Angasada, Shiroruja. So these are quite common. There's no special things are there here. You can understand this. Yeah. Next, this is very important. This can be asked for MCQ. So these two you can see while when Vagbhata and when the respective Sushrita subject comes, that time you can see. But let's discuss with the 10 types of this 10 types of Vapat told in Charaka. Yeah, so these are the things you can remember. So you categorize into two. There are total 10 in number, very important one. 10 in number. You categorize it as the Ati Yoga and Ayoga. You can see the mnemonic here. आप सभी ही ग्रेट जवान वीर सिपाही उन्होंने किया. आप सभी ही great जवान. A means Admana. One more A is Admana, Parikartika, Strava and Stamba, and H is Hridgraha, and the G is, that is Jivadana. Okay, so like how you can remember. And one more, this J is like Gatra Graha, right? So you can understand like this. And the Unhone Kiya, K is Klama, and U, it starts with U, that is Unhone, that is Upadrava. So like this, you can remember all these 10. Admana, Hridgraha, Gatragraha and Stamba, these are the Ayoga complications. Coming to Ati Yoga, that is Parikartika, Srava, Jivadana, Vibramsha and Upadrava and Klama. So in that, this Jivadana is very important one. So there's a chances of asking this in MCQ. Yeah. So here, so these are the, this shloka explains about the 10 types of vapors. But what is so important here? So this word is very important one. Because Acharya has used the word Preshya here, that is considered as Paricharaka. So very important. Preshya is Paricharaka. Everywhere he explained about, first he started with Vaidya, all the Pada Chatushta, but there's a reason why he explained Presha. Because Presha Bheshajya Vaidhyanam Vaigunyat Aturasya cha. Why the complications arises? It is arise because of the deformity of the Preshya, that is Paricharaka, and even deformity of the Bhaishaja, that is medicine, and one more, that is Vaidyakrita mistakes, and Vaigunya Dhaturasya. Aturasya is, it is the mistakes done by the patient. So if these are there, then it is going to cause the Dasha Vapats of Vamana and Virechana. Right, so this word is very important and sequence is very important. Preshya is Paricharaka, Bhaishajya, Vaidhyana, Vaigunya, Aturasya. Yeah. See, you can see here Vapats, that is complications. As I already, these are very important. Akhala Alpa Atimatra, Purana Aushada, Na Bhavitam, and even Samyak Samskritam. These are four important points, are very important. Why? Because Akala and Alpa Atimatra. If you are giving the medicines with the improper timing, with the improper dosage, that is going to cause the Vapat. Purana Aushada, why Purana Aushada? Because it is the medicine is kept for longer days, it loses its potency. Okay, so if it is loses, means it is not causing the proper Samyak Shodhana. Then Na Bhavitam, if you are not giving the proper Samskara. And many of the drugs, while giving the Shodhana of that Vamana drugs or Virechana drugs, should be give proper Bhavana. Then only the Samyak Yoga takes place. Otherwise, you don't get the proper effect. Like Madanaphala preparations or the Trivrit preparations, all the drugs you should prepare properly. Samyak Samskritam, it is improperly processed because the samskara is the very important point. Samskara se gunantar dane. If you give samskara, there's a changes of the qualities of the drugs. If there is a changes, then you can, like the example, like dadi can be converted into takra because dadi is comparatively having the not good properties, but takra, if you give the proper samskar, it will give you the proper laguta to the body, or the deeptagni will be taking place. Like how the proper samskara is needed for the drugs. So these are very important points. They can ask like why the vapats are common. See, you can see here Vamana and Virechana things. Like, so when you are giving the drugs, there is a chances vomiting, Vamana drugs you are giving, it converts into the Virechana. Why? Because when there is a Shleshma Vriddhi in the body, when there is a Durgandhata, Ahridya or Ajirna, if it is there in the body, if it is there, then it is causing the vice versa actions. Even Virechana Aushadhi you are giving, but it turns with the Vamana. Why? Because when a patient is excessive hungry, when he is having Mridu Koshta, when Kapha is Utkleshta, then the medicine acts as vice versa. If the medicine is digested without purification, examine the patient, strengthen, and again you have to repeat the dose. It is very important for practice. Right. If the paka happens without purification, ashodhana, what you have to do? You have given the medicine. There is no. There is already the medicine get digested, but there is no samyak shodhana lakshanas. So you can again examine the patient. Think about the proper dosage of the medicine. Then go with the one more time of the administration of the medicine. See, this is very important one. So Dushcharda Dushkoshta. What is it? Second dose when you should not give, because one who does not vomit even after the medicine, one whose bowels do not move after the medicine, because if you give the medicine, what happens? There's a chances of the death of the patient. Why? Because medicine is still there in the body. So it is there in the body. Again, if you give one more dose, there's an overdose of the medicine. So the patient may even enter to the synco for the like what Mother Murcha Sannyasa happens. So there is a chances of the death of the patient. You can see here Ayoga Lakshanas, Ayoga deficient administration, like Snehana Svedana is not proper, using a Nava medicine or the in a Ruksha body. A Nava is already the body is Ruksha and you are using the older medicine. Then because of the lack of the potency of the drug, you don't get the proper results. And if it is lack of snehana and svedana, there is no dosha utklesha itself, then also you don't get the proper effect. Right. That is how the medicine is not going to cause the good effects in the body. And it is what happens if you give the medicine itself is entering in the body because it is going to produce again the ama in the body. That is how the ayogas are happening. So first start with the ayoga. That is why ayoga happens. It's quite common. The drug dose is very less. It is causing the shvayatu because it is not neither going urdhva nor going downward path. So where it should be there? So there in the koshta itself is staying and it is producing the lot of complications. Vibramsha, shvayatu, hikka. Yes, this is very important one. The residual medicine is causing the darkness in front of the eye and pindikodveshtana. So pindikodveshana, you can see it in the Purisha Vegadharana Lakshana. Why? Because it is going to give a hint about the Vata Vriddhi. So the vitiated Vata is staying in the body and it is producing the kind of cramps in the calf region. And even Kandu, Urusada, Vivarnata, this is all are because of the Vivarnata. So what you have to do here? It is quite common. The ayoga is there. So you just remove that vata from the body by giving the Taila Lavana Abhyanga. This Taila Lavana helps you to combat the excess vata from the body. Then quite common, there is a Sneha Svedana. After Snehana, you should give the Svedana. Then you make the patient to drink the medicine one more time. Then Samutra Niruha. Why Mutra Niruha told here? Because Gomutra is the Tikshna Ushna medicine. If you again give this Gomutra, it is going to flush out the excess, the dose what is there in the body. It is like it is going to cleanse the body. Cleansing action will be common here. And Dhanva Mamsa Rasa. Why Dhanva Mamsa Rasa? Again, you should nourish the body. So if loss of strength is there, you can give the Dhanva Mamsa Rasa and that is how you can maintain the balance of the statement, the body of the patient. Madana Faladi Hanuvasana, wherever because Hanuvasana is needed because you are going to give the Tikshna Shodhana. Tikshna Shodhana, there's a lot of energy is removed from the body. To achieve the energy, to achieve again the bala of the patient, you can give the this Anuvasana Basti. This is going to help you to regain the bala. Yeah. Ati Yoga here. Why Ati Yoga? It is common. When you are using more kind of sharp drugs, like the patient itself is having Mrudu Koshta. His bala is very less, Mrudu Koshta is there. But you are overdosing the patient means quite common with the more number of Vegas comes. So quickly with kapha eliminates and even the dhatu also gets affect here. Like yes, balasvarakshaya, daha, kanta, shosha, brahma and krishna occurs. Yeah. Chikitsa. Yes, there's a lot of strength is out of the body. You can regain by giving the Madhura Aushadhis, right? When Vamana Ati Yoga is there, you can give the Mrudu Virechana. Virechana Ati Yoga is there, you can give the Mrudu Vamana. And if it is more, you just take the cold water, make the Parishechana on the patient so that the patient can regain the conscious. Like Rakta Pitta Atisara Daha Jvara line of treatment you can follow because it carries all the same way of the same line of the treatments. Yeah. So Ati Yoga, This Anjanadi Manta, Vatadi Shrunga Kvata, Atisaragna Siddha Kshira, Pichabasti, and Madura Aushada Siddha Grita Anuvasana. Very important one is Pichabasti. When you see the Raktatisara, okay, when you see the Arshas, there is the reference of the Pichabasti, because this Pichabasti is made with the help of the Shalmali Niryasa. There are two methods, one is Putapakva and one more is same. You can, one more is different, where you can add the Kshira in this, you can prepare the Basti. This Basti is going to helps you to do the Stambhana action in the body. If it is Ayoga, it makes the Dosha Stambhana. So then the patient feels happy. Why? Because whatever the pain is there, whatever Ati Yoga Lakshanas are there, that is going to reduce. So it is very important. When Ati Yoga is there, you can give the Pichabasti. And Atisaragna Kshira. Kshira is quite common. It is Brahmana, it is Balla and Madura. And Manta and this Kvata, Vata is also having Stambhana or Kashaya Rasa is there. That is how makes the Stambhana. Yes. Vamanati Yoga, Udgara, Murcha, it is common. You can give the Shitambu Parisechana, Kafahara, Mantas which is prepared out, Madhu, Kshaudra, even with like Dharnika, Musta, even with Anjana, along Anjana Churnas, along with Madhu, etc. you can use here. Yeah. So this is very important one. Another condition where you can handle manually, like Antaha Pravishta Jiva. Because of Pati Yoga, if the Jiva or the tongue displaced inside the oral cavity, what you have to do? You can give the Kavala, because it is the localized treatment. The Sthanika Chikitsa, you can give Kavala with Snigdha Amla Lavana, Hridya, Kshiras you can give. It is helps to maintain the condition. What is the trick? This is very important one. So this can be asked for MCQ. So another person, the person who is sitting or the Paricharaka who is sitting in front of the patient, he should eat Amla Rasas. Why Amla Rasas? Because Amla Rasa, it is going to produce watering sensation in the tongue. After seeing that the affected person, his tongue naturally comes out of the oral cavity. So this is very important. Nistrita Jivha, protruded tongue is there. How to do it? So you can apply some Draksha or Tilakalka. You can gently use the hand and push it backwards to the oral cavity. Then next one is Vakgraha. So Vakgraha, naturally Udana Vata is the one responsible Vata that is vitiated here, that is going to produce the deformity of the speech. So what is the treatment? Yavagu prepared with Grita and Mamsa, then Snehana Svedana, just to control the excess Vata. You can, quite common, you can adopt all the Vatahara line of treatments. And the next one is Admana, very important one. Admana is, there is accumulation of Vata inside the abdominal cavity. So you first thing is, accumulation leads for the pain and some of the discomfort in the abdomen. So you can see here, what are the causes? All the Vata Vriddhi causes. Rukshata, Udavarta. Udavarta is upward movement of Vata. Mandagni, Bahudosha Avastha is there. You have not given the proper medicine to expel it. That is how the Vata Vriddhi produces the gaseous collections in the abdomen. That is going to produce some of the pain. That is Nabhi, Shira, Prishta, Parshva. Two Parshvas and even Vinmutra Vata. That is going to accumulate in the abdomen. That is produces the pain. So the treatment is very simple. Vata is accumulated. You have to release it from the body. So just go with some nice Abhyanga and Svedana to the Guda region. Take any of the Vartis. Then insert into the Guda Marga. Release that Vata. Then after that you go with the Anuvasana Basti and Udavarta line of treatment. Even Udavarta, first they have told about Charaka, Chikitsa Asthana, 26th chapter, Trimarmiya Siddhi, Udavarta is explained. He explained, first go with the Varti, then go with the treatments like Virechana. In that specifically he highlighted about Sneha Virechana, because the involved dosha is Vata, you can go with the Sneha Virechana, right? So a very important one, remember. So Parikartika is another important one. Parikartika is cutting pain in the anal region because of already the patient is having Snigdha Kosta, you give a very stronger medicine. Kshama, strong medicine in Kshama or Mrudu Kosta person. That is going to cause excess flowing of the medicine. Sudden dosha elimination, there is a Tivra Shula. One more peculiar quality, pain is more. That is how Parikartika, cutting type of pain. Kartika is cutting type of pain is common here. And even it is characterized with this one. Very important. Why? Because the dosha is expelling more. That is giving pressure over the anal cavity. That is going to cause the excess bleeding in the like picha along with the motions. Yeah. So again, very important treatment. If it is Sama, it is common that you can go with Langana Pachana, Ruksha Pana, because the Sama is having the Snigdhata Lakshanas. And what is the diet? Kshara, Amla, and light food you can give, like Vatolbana, Pushpakasi, Kshara, Lavana, the Adima Swarasa, these and all give, because the Adima Swarasa is going to act as Deepana. Then the like last one is Madhura Shita Pichavasti. See, this is also very important. Yashti Madhu Sneha Basti. Why Yashti should be given here? Why not with other drugs? Because Yashti Madhu, it is going to make the Sandhana. It is going to help to have the wound healing property. And Ropana. This is going to make the Ropana healing as well as joining the ends of the wound. And one more is Yashti Madhu is where there is a burning sensation is more, pain is more. Yashti Madhu, it is going to reduce that pain and burning sensation because it is Pittahara. Yeah. So Parisrava, next one is Parisrava. If the patient is very Durbala or he is weaker one, then if you give the dose very high, so that is also going to produce the more Utklesha. Lakshana, Alpa, Alpasrava, Kandu, Shopa. There's a frequently the scanty kind of discharge will be happening from the body. It is not like once only the discharge is coming. No, like Alpasrava, Alpa, but the frequency is more here. What is the Chikitsa? Again, you have to go with the Punasnehana, Svedana, then you can go with some of the Tikshna Virechanas. Hridgraha, there is a graha means there is a stiffness or tightness in the Hrid region. See here, why it happens? Main reason is Vegadharana, very important one. When you do the Vegadharana, if you have given the medicine to the patient got any Vegas like all the Vegas it is mentioned in the Ashtanga and even Charaka. Any urine comes, urine Vega comes or the motion Vega comes or any of the sneezing comes. When he is suppressing, then definitely it is causing the Hridgraha. Why? Because when Vegadharana is doing, then that is definitely increasing the Vata dosha. So this Vata dosha vitiates and plays here in the Hrid region, that is causing the pain or the some kind of discomfort in the the Hrid region. So Hikka, Shvasa, Parshvavarti, Dhainyata, Lala, Srava, Akshi, Vibhrama, and even sometimes it is going to cause the unconsciousness because this Hridaya is the seat of the Chetana Tattva. And this is one more peculiar thing. Patient bites the tongue and grinds the teeth, dantan, kita payana. So why? Because this is produced due to the excess aggravated Vata dosha. Yeah. If it is Pitta Janya Murcha, you can go with Madhura. If it is Kapha, you can go with the Katudra. Like all sorts of Viparya or opposite line of treatment you can manage here. Pachana Aushadhi you should give because there's a Ama or the Agnimanda is there, you can give the Pachana Aushadhis. So that is going to help to remove the obstruction of the doshas. Next one is Angagraha. So you can see here. Graha is suggesting that stiffness, Anga is body parts. Why it happens? When there is a suppression of urges, that Vata Vriddhi leads to the obstruction of the Kapha. Like the Stambhana or the Vepatu or the Sada, there is a exhaustion, Nisto, the Manta. These are the common things arises in the patient. So what is the line of treatment? As I already told, there is a Vata. Vegadharana leads for Vata Prakopa. It is quite common to understand. You can give the Vatahara line of treatment. So Vatahara is best. Like Snehana, Svedana you can give. Right. So one more very important point is Jivadana. So what is Jivadana? You are using more kind of sharp or Ushna, Tikshna medicines in the Mrudu Koshta patient because he is not having the tolerance capacity itself. So what happens? Because of that, there is a fresh blood comes out of the body. So what to do, whether it is good or bad, the pure or impure blood. So give the blood to the animals, like you can see here, there is a dog, even just like Rakta Pitta, how you can do, that method you can use here. So if this dogs and this crows, if it is eating that blood, then it is considered as Jiva Rakta, very important. It is like emergency. Many of you can say there is no emergency line of treatment in Ayurveda. So this is the best example. Acharya Charaka has given the emergency management. If it is not eating, then it is understood that there is a vitiation of the pitta. And the one more test is cloth test. You just take the white cloth, soak it in the blood. So just if then again wash it. If it is easily goes out, then that is Shuddha. If it is not, then that is vitiated blood. Yeah, you can see here Jivadana. There is a Krishna, Murcha and Mother. Why? Because the Rakta itself is not there in the body. That is going to cause some of the lacking Lakshanas. So what to do here? All Ati Yoga Hara treatments, as I already told, that you can follow. And even, so this point is very important. Mrigadi Prani, Raktapana. Acharya highlighted about Pana. You just take the fresh blood of all these animals, just give it to the patient. That is how Samanya Vishesha Siddhanta, blood is going to increase in the body. And one more very important, nowhere reference is there, very important reference. They'll ask what is the reference of Rakta Basti in the Charak Samhita. Answer is Jivadana context. Charaka Siddhisthana 6th chapter Vamana Vapat. So you take the fresh blood, then you just add it with the kusha, then give it to the patient in the form of basti. Then Shita Basti, yes, this Grita Mandanuvasana is also important. There is a supernin fluid of the Grita Manda that you can give, and you can give it in the form of basti. Then one more is Picha Basti, as I already told. See, even there are a lot more research works are conducted on this Rakta Basti. Even many of the Pandu cases, one university has taken this study. You can take the Rakta fresh blood and just add with the 5 grams of Kushasvaras, 5 ml of Kushasvaras, that you can give it to the patient. It was conducted in Maharashtra. So the results were also good. You can refer into the articles. Yeah. So again, the last one is Gudabramsha. It is prolapse. Yes, there is a protruded mamsa comes out for the Guda region. So that even you learnt in Arshas also, Arsha Chikitsa. Kashaya Rasa, you can first you just wash the place nicely with Kashaya Rasa. Then manually you can fix it back as you learnt in the arshas. If it is samnyanasha, then this very important point is Sama Gandharva Shabda. Just play some of the music of Gandharva songs in front of the patient. So there is a chance of regaining the conscious. As you learnt in the Charaka Sutra Sthana Vidhi Shonitya Adhyaya, in the context of Murcha and Sannyasa, Acharya told just to make the patient to recall his past experiences. That is how going to produce some of the signals in the brain. That is how he can remember the past experience. So there is a consciousness will be arised in the patient. So Gandharva Shabda, because in the older days there was no music therapy and all. It was the mantras you can recite in front of them. It is going to give the positive energy in the patient, so it regains the consciousness. That can be asked for MCQ. Yeah, stamba, stiffness. So see here, already given the lubricated patient uses medicine. When it is combined with sneha, the medicine, due to its mridu quality, it gets covered by dosha. Already given the snehana to the body, and one more time you are inducing the sneha. So both together causes the stiffness. Right. So here Vata Sanga, Gudastamba, Gudashula, because that is producing everywhere the stiffness in the body. Right. Then there is a Alpashaha, very important. There is a small quantity of the dosha will expel out. So you can go with Langhana, Pachana, Tikshna Basti you can use, because you need to remove that excess snigdhata from the body. That is how you can give the Langhana and Pachana. Yeah, the last one is Klama. Klama is exhaustion. So mild medicine in Snigdha and Mrudu Koshta, because should not like it is going to provoke Kapha and Pitta, so it is going to obstruct the Vata. So symptoms like Tandra, Gaurava will be common here. So what is the line of treatment? You can go and give the Vamana or Langhana, Pachana, Snigdha, even some of the Tikshna Shodhanas also you can give to just make the cleansing of the body. Yeah. So this is the summary part of this chapter. You can learn about what is the kala you should prefer for Shodhana, and what to give to the patient after. Before Shodhana, you can give the Snehana, Svedana, then later you can go with the Peyadikrama. There is some exceptions of the Peyadikrama where you can go with Achatarpana and Ghanatarpana. Then you can start with this Yoga and Atiyoga Lakshanas, and those respective Lakshanas and its own Chikitsa. And even some of the explanations like Raktabasti is very important, and even some of the Jivadana context, Raktabasti, even with Pichabasti also they explained along with Raktapana. So these are some of the important points of this chapter. But Jivadana is very important, and 10 types of Vamana Virechana Vyapats are important. Contraindications of Peyadikrama and Preshya. Preshya he started with Paricharaka, but everywhere he started with Vaidya itself. So that is one of the point you can remember from this.